Hi, everyone. My name is Sunehra Ali. I am a graduate student for the Communication Science and Disorders program here at Elmhurst. And this is my project, my research thesis. It's looking at how speech-language pathologists can collaborate with healthcare professionals to promote language literacy in children ages 0 to 5. We're looking at this through parent-child interactions and to ensure kindergarten readiness. Just a little bit of background. Early childhood is a very critical time for children to develop emotional, physical, social, and cognitive linguistic skills. These skills will help them succeed later on in school and in their careers. Once again, the objective was to look at how we can collaborate the two disciplines to ensure that language and literacy skills are being promoted through parent-child interactions. Within this study, we looked at the many ways that parents and children interact. We looked at how confident healthcare professionals are in their role in language and literacy. We also looked at speech-language pathologists and how confident they are in their role. So let's just jump right into the results. Survey results suggested that there is a lack of awareness about reading programs amongst healthcare professionals. This is something that we kind of hypothesized. Healthcare participants also stated that they have collaborated with SLPs in various ways, such as plan of care, meetings, referrals, and reading through their notes for some patients. When asked if SLPs can collaborate with healthcare professionals, many participants stated that they don't collaborate due to being unsure if healthcare professionals are interested, due to limitation of time, and because in certain settings, in order to collaborate, they may need a formal diagnosis, referral, or permission from admission. Let's jump right into demographics and responses. Let me zoom in here so it's easier for us to see. So here are just some tables from my research thesis. The first three are just looking at demographics of healthcare professionals, speech-language pathologists, and parents. The first two are looking at genders, years as that professional, and then the current clinical setting. This last one here is looking at the age of children of parents who did take our surveys. Let's jump right into some responses. So here on the left, you can see some healthcare professional survey responses. When asked if they understand their own role in promoting language literacy, when asked if they're confident in their abilities to promote language literacy, and asking if they understand the SLP's role, the majority of our participants stated yes. When asked how healthcare professionals encourage patients to read, they said that they give families books and resources. They asked the child to read during the appointment, which we thought was interesting. They discuss what the child reads with the parent and with the child, and they make recommendations and collaborate. Some open-ended questions. When asked to share what makes them confident in their role to promote language and literacy, a participant said that their goal is to promote functional communication when working with individuals who have special needs, who often have language deficits. This individual studied verbal behavior in their graduate studies and have experience working with verbal and nonverbal students in a home therapy and school setting. When asked what makes them not feel confident, some professionals stated that they are bilingual and have general knowledge, but they're not sure that they would say confident. And then some said that they may not have the proper tools or resources. When asked if there are ways that they have collaborated with speech-language pathologists, some of our participants said that they have placed referrals, they have collaborated via IEPs and made intervention plans that can be implemented daily, and that they share a spreadsheet where both professionals can be aware of what is going on with the child's language barriers, learning delays, and so on and so forth. Now we can look at the speech-language pathology survey responses. So when asked if they understand their own role and how confident they are, the majority said that they agree that they are confident and that they understand their role. When asked how they encourage their clients to read, they said that they offer reading resources. They ask the child to read to them. They play reading-related games. They discuss what the child has read or is reading. They make suggestions to parents, and then they do other things outside of books, such as rhyming, phonological awareness, playing games, crafts, kind of using what they have to promote the language and literacy. When asked what their beliefs are about SLP's role in language literacy, it was interesting for us to read that or see that a good majority of our survey responders didn't think that SLPs know enough, which just goes to show that we need to put more resources and put more information out there. When asked if they're aware of reading programs, 6 out of our participants said yes, and 10 said no. So this also goes to show that it is our job to kind of put that information out there, spread the knowledge about different reading programs that can be offered for children to help promote language and literacy. And then recommendations, when asked SLPs what recommendations they could make for healthcare professionals, they said more education for them and then make them aware of community resources. So just pretty much, once again, reiterating what I just said. Some responses for speech language pathologists, open-ended questions. When asked the ways that they've collaborated with physician or healthcare professionals, they said that they've helped create worksheets for children and adults with information on how to encourage literacy in regards to their goals, which is really good to hear. And then when asked what recommendations they can make towards physicians, we kind of touched on it here, but here are just a little bit more responses that were given. And then let's jump over to responses from parents. So one thing that we thought would be really good to look at, given that we're looking at dual language learners, is what languages are spoken at home. So about half of the participants speak English only, the rest speak English and additional languages. Some speak just languages other than English in the home. When asked who reads to their child on a regular basis, most of the responses included parents or grandparents, the rest are siblings, other relative, person not related, maybe a babysitter or something like that. When asked how often the child is read to, we had varied responses. So every day, about 21 out of our 61 participants, most days 15 participants, some days 11, and then rarely and never 9 and 4. When asked what is done as they're reading to their child, we had really interesting responses, really good responses. About 47 participants said that they point to pictures and they asked the child to point out, this is really good for developing that language and literacy, and then the parent-child interactions. They talk about what happens in the story. They encourage a child to talk about what's happening. They ask questions about the story. They point out to letters and words. They ask children for help reading, or what sound does this animal make, for example. And then I was really interested to see that parents will actually do activities around the book. When asked what barriers there might be, it was very common that busy schedules and time management were barriers, and then other activities and distractions such as sports or vacations or just other prior arrangements. We did want to ask if there were any services being received from the parents, and 9 out of 61 participants said that their child is seeing a speech language pathologist, 6 said OT, and then 6 said early intervention, and the rest said no services. We also wanted to ask parents how often healthcare professionals discuss reading, and it was interesting and kind of hypothesized that this was mostly done during these well child visits, which are, maybe every 6 months, every year, something around that. And then it was also really interesting to see never. So about 24 participants said never. When asked parents for recommendations for healthcare professionals, they said that they would like the healthcare professional to encourage, to offer resources, to educate parents. And then we added just a little bit of specific demographic information down here. Here we have the open-ended questions to parents, which just elaborates on the recommendations for healthcare professionals here. So majority of it is like encouraging. However, the just responses varied just a little bit. Now I'll zoom out here. What we used in our research thesis is the ecological systems theory, which is by Bronfent Brenner's model, 1998. This model pertains to links that can exist between two or more settings that a child is in and the impact that it can have on their lives. So parents' workplaces, extended family members, neighborhoods where children live are example of such places and people. I wanted to kind of touch a little bit on the microsystem and the mesosystem here. Microsystem is their immediate environment, such as their home, school, daycare, so on and so forth. And then the mesosystem are the largest and farthest collection of people and places that have a significant influence on the child. So it can even be anyone, you know, like a teacher, for example, or a daycare person, babysitter, even something like that. Then I wanted to talk a little bit about roles in literacy. So the speech language pathologist plays an important role in literacy. We support children's language skills that underlie successful literacy achievement. We collaborate with teachers to support rich language instruction, and we assess and we provide intervention for children who have language disorders and language-based reading and writing disorders. Parents have a huge role. Numerous studies have shown that parent-child interactions play an essential role in children's early language and learning. Studies have shown that early language experiences, such as turn-taking during conversations, matter for later language and literacy development. Children's early language development is strongly influenced by the amount and the style of language parents use when conversing with them, to each other, and for children to effectively learn about objects in the environment and the events in their environment. It's very important that they hear adult speech that's varied and rich in information. According to the Encyclopedia on Early Child Development, language and literacy development are additionally influenced by several other things, such as parents' age, their education, their income, their race, ethnicity, so on and so forth. Through years of research, it's become clear that relationship between parents and children play a crucial role in children's socioeconomic, cognitive, neurobiological, and health outcomes. There have been many studies that we looked at that kind of just went into detail about how important parent-child interactions are and the short-term and long-term effects of such interactions, such as, you know, being an emotionally stable person as an adult, given your parent-child interaction, given the time that your parents spend with you, reading to you, that kind of thing. And then we're looking at roles of healthcare professionals. So through their relationship with families and children, healthcare professionals can make a significant difference in children's school readiness. According to the American Academy of Pediatrics 2016, healthcare professionals have a significant impact on school readiness due to their relationship with families and children. Healthcare professionals are not only well positioned to advocate for children's access to healthcare and high quality early childhood education and resources, but they also can model adult-child interactions during these appointments. They can observe, how is this parent talking to the child? How is the child talking to the parent? What is the comfort level? And then they can go on and kind of model what the appropriate style of interaction should be. A part of our survey our research thesis looked at bilingual emergent literacy in children. So the number of bilingual children around the world is growing rapidly, and parents need to be aware of the importance of emergent literacy in bilingual children for improving their educational, social, and career outcomes. So by promoting language literacy in one or both languages in the family, bilingual families can foster linguistic diversity, and early literacy activities can be effectively supported by families that speak more than one language. In fact, it's better if they do it in both languages. Bilingual families, according to Hoff 2013, are at a higher risk for poorer literacy, language educational, and career outcomes than monolingual families. Bilingual families who come from low SES backgrounds are particularly vulnerable to this problem. It was interesting for us to find that according to supporting research by Chow et al. 2010 and Roberts 2008, reading stories in a child's native language does not affect his or her ability to learn English because a child's native language, because learning is transferable across languages. Unfortunately, materials may not be available in various languages. They may not be readily accessible, and the majority language may be promoted, such as English in the United States, because children are educated and cared for in that language. And then we are here at the conclusion and recommendations. So based on the results of the survey, parents in low SES communities teach and maintain language literacy skills with their children in a variety of ways, such as pointing to pictures or asking the children to point out main characters, talking about what's happening in the story, encouraging the child to talk about what's happening, asking questions about the story, pointing out letters and words, asking children to fill in words as the book is being read and doing an activity around the book. These are really, really good ways to promote language and literacy. And it was very good for us to see that parents are doing these. Healthcare worker, some recommendations that we have for healthcare workers are that they teach parents in low SES communities about language literacy skills through giving them books and resources, asking the child to read or share about books during appointments, discussing what the child reads with the caregivers, and continue to make recommendations for best literacy promoting practices. It's also very important that, you know, we as students, we as people who are entering the field can, you know, kind of educate others about reading programs such as Reach Out and Read and other literacy promoting programs, local programs. It is possible for healthcare professionals to play a significant and influential role in promoting literacy by prescribing a book, providing resources and handouts, encouraging and reading and teaching parents and caregivers to read aloud more frequently. And like I said, by supporting local and national literacy campaign programs such as Reach Out and Read. Thank you so much for watching my presentation. I hope that it all made sense. Thank you. Bye.